to change the date. So I will record the session anyway, so it will be available for everyone, even out of the course. So first of all, let me introduce myself. I'm Dr. Ibrahim. I'm NHS doctor, and I'm a PLAB 2 instructor, and I run a course for PLAB 2 and online MOOC session. This session, from my point of view, is very important, and I consider this session the most important one for the PLAB 2 journey, because I've heard recently from many doctors in the exam a lot of main rumors and a lot of wrong information about this exam. And from my point of view, it is easy exam, but it's easy to pass, easy to fail. Okay. Easy to pass, easy to fail. Just put this rule in front of your eyes all the time, okay? And in today's session, I will give you information from my experience in the NHS and from my experience with doctors. Thanks God, alhamdulillah, I have helped more than 2,000 doctors to pass their exams through the online MOOCs and the online course. It's very hard for me to give online MOOCs anymore. I give like 2 or 3 per month, but I still keep doing it. So this experience from the doctor who conduct their exam already and pass with a good score, and it is also a realistic experience from the NHS. Okay. First of all, I will explain things in general. And if you have any question, write it down, and I will give you time to ask your question. Okay? And we might do this session again for those people like I'm receiving a lot of message actually for people who can't attend. As I said, it will be a recorded session, and I will try to share it on my YouTube channel and in my groups, and we can conduct another session again later on. I will try to cover all the approaches, the tips and tricks and avoidable mistakes in most of the approaches of the exam, but we might not be able to do it in one time. So maybe we'll arrange another session next week. Okay. I came today to give you things that you should do and people don't usually do in the exam, and things you should avoid in the exam. Okay. My voice is clear for everyone? My voice is clear. Can you hear me? If you can, just give me a thumb up in the chat. Voice is clear. Okay. Okay. So first of all, PLAB 2 exam. PLAB 2 exam is an OC exam that you will have many stations, and it is conducted only in UK. We have 3, I think, test center nowadays. 1 in Liverpool, and 1 in Manchester. I think there is 1 in London. I think there's 3. So, or it's 2. I'm far away from this actually. You will have to do this in the test center in UK. So you have to apply for the visa and all this stuff. Okay. And it is a realistic simulation for your job in the NHS. Okay. So first of all, you have to bear into your mind that this exam is realistic simulation for what will happen in the job that you will apply for in the NHS, which should be a junior level job. Okay. Because I know for many doctors, I've seen this through the MOOCs and I've seen this through the exam. A lot of people that conduct this exam are seniors. I mean, I've seen a lot of consultants doing this exam, not consultant, doctor at level of registrar. I mean, they are not very junior, they are senior doctor, okay? But this exam is designed to assist a junior doctor. So you need to know your abilities and also to respect your limitation, okay? So you need to act like a junior doctor. And at the same time, this doesn't mean that you need to show that you don't know anything. Okay, no, it is just a balance between being a junior doctor and being safe at the same time. I mean, when you will start your job in the NHS, you will not take all the decision by yourself. There is levels for these decisions. Okay, yes, you have the knowledge and you have to show this knowledge, but you have to show the knowledge in the way of your level. Okay, try to understand this point. You might be asked some questions in the exam, and because you know the answer for this question, but it is not like a question at your level. This is a consultant question. So you shouldn't give like a definitive answer for the exam, but you might show the role player or show the examiner that you know the answer. Okay. Like for example, if someone asked me about the treatment or how this surgery might be done or how this colonoscopy could be done, I would say I would give like some explanation for it in like the way, like for example, yeah, I think this is could be done through this and that and those, and they usually do this and they usually do that. Is not your role, and it is not definitive answer. And I think the surgeon, for example, will be more experienced than me in this aspect. He might give you a very clear answer about it. Okay. Even if they asked you a medical question and you don't have the answer, okay, or even if you have the answer but it is beyond your level, and I will give example for this right now. Don't give a definitive answer for it. Okay. Also in the exam, this exam is not a medical exam. It is not a pure medical exam. And even the medical part of the exam is very small part, okay? The medicine station in the exam is like a limited number of stations, 2 or 3 stations, okay? And in many situations in the exam, in many medical stations in the exam, you don't need even to give a definitive answer, a definitive diagnosis. You might need only to give a provisional diagnosis for what's happening. Okay, so you need to act like a doctor in the NHS. Okay, you don't need to show all the knowledge you have, but you need to show the knowledge you have in the way they do it in the NHS, and this is what I will explain today. Okay, you need to be a safe doctor, a caring doctor. Okay. You need to address the patient concern. This is the secret for this exam. And the most important point for this exam is to manage your time, okay? In the exam, you will have 16 stations. Sometimes you will have 15 stations, ranging from medicine station, counseling stations, demand teaching, breaking bad news, medical errors, prescription station. So phone calls, and these phone calls could be any one of those, especially the counseling and the medicine station. They even start to bring more medicine station in the form of phone calls. And this started to happen since the COVID, and I think they will continue bringing such type of station. Okay, they will give you 1.5 minutes to read the station and 8 minutes to do it. So let's take it step by step. The day of the exam, you need to relax. The day before the exam, I would say don't study anything, just relax, just keep chilling, okay? Don't do anything, okay? The night of the exam, try to sleep enough. This is very important, and it will not come from like, you need to train yourself to sleep very well, because this is important for the exam. And I've seen a lot of people, they didn't manage to do well in this exam because they didn't sleep enough the previous day, and this have been happened for at least one time with us in one of the medical exams. Okay, so try to sleep very well. Try to sleep very well in the night of the exam, and then you will go to the GMC building 30 minutes before it. Okay, I know that a lot of people might feel anxious, feel nervous in the exam. Try to sort it out in a suitable way. Okay, manage yourself. You're a doctor, and don't ask for advice. Actually, you're a doctor, so try to sort this anxiousness and nervousness out in a suitable way for yourself. Why? Because it's very important to be relaxed in the exam. Okay. And another common avoidable mistake that a lot of people deal with the whole situation like an exam. It is not an exam. Okay, it is the wrong way to deal with the situation as an exam. It is not an exam. It is a normal day in your hospital, a normal day in your clinic, a normal day with one of your patients. And if you tackle the situation in this way, you will pass. I guarantee that you will pass with very high score. Okay. If you are funny in the exam, if you relax in the exam, if you like manage the situation in a relaxed way in the exam, you will pass with high score. So before entering the exam, try to make sure that you will be relaxed, not nervous, not anxious. And also you have to train yourself to do that. And one important thing, which I think everyone is doing, is practicing like simulation for the exam, like mocks, and practicing with your colleagues. This is one of the ways that you will make you relax in the exam. Okay. And as I said, medically manage yourself to be quiet and relax in the exam in the way that will not harm yourself. Okay. Then you will enter the exam, the place for the station. They will give you 1.5 minutes to reach the station. I would say this is the most important 1.5 minutes in each station. There is 1.5 minutes to read each station. There will be a station, a paper outside the cubicle, and the station will be written down. Try to read the station as much as you can. And this is for you. All the station that you will see in the exam, you already seen in your notes. Again, all the station that you will see in the exam, you will see in your notes. You have heard this word, don't be scripted. Actually, the GMC is very scripted, but is in a different way. They will bring the same station from your notes, but with different concern. And this is actually a fatal mistake, and it is avoidable also that a lot of people do. When they read the station, okay, this is ECG teaching, so they want me to do this and do that. So they might not even reach the end of the station to see the concern. Okay, this is breaking bad news. Okay, this is a problem with my colleague. He posted a post on a Facebook. Okay, so I know the story and I know what I will do. Okay, so I will start to prepare myself for the station, and I will not even read the. Believe me, I swear God, this happened in the exam. Okay. This is the attitude, and even this was my attitude in 1 or 2 stations in the exam. Okay, so one of the common mistakes is not to read the concern, because the concern is totally different from the one in your mind. Okay, the concern is totally different. Try to read the concern again and again and again. Okay, sometime he will see, he will say in the station, discuss this with the patient and address the concern. Okay, sometimes he might say, try to find out why he got this. Sometimes he might say, explain the result and arrange for another test. Okay, so now it is not a medicine station. So you have to read the station till the end and to focus on the concern. Actually, 8 minutes is not enough to do the station. Okay, in my hospital, and you can ask any NHS doctor, 8 minutes is not enough at all to do any station in the exam. And this is for your knowledge. The examiner in the GMC, they know that 8 minutes is not enough at all to do the station. It is only you that you think that 8 minutes is enough to do the station. So you will try to say everything in the station, and at the end you will not say anything. Okay, so my advice to you, try to prioritize your question. This is the first point. Try to prioritize your question in any station. Try to arrange yourself. Okay, think about it in this way. I have, like, for example, 4 minutes for the history. Which question I should ask? And this will not happen in the day of the exam. You should do it from today. Even if your exam will be tomorrow, try to put a structure in your mind. This is, for example, a medicine station. and this is about something about a presenting complaint. So I have to analyze this presenting complaint first. And if I got more time, I will ask any other extra question. Okay. So they will forgive you. No, they expect actually that you will not ask all the question. I know even in my notes, okay? If you took my notes to study from it without the course, you will ask all the question in the station. Like there's 30 question in the station. Do I need to ask those 30 questions? No, you don't need, okay? You just need to prioritize which question you will ask. Do I need to ask the family history in each station, the smoking history, the alcohol, this stuff? Yes, you can ask actually, but be easy with yourself that you will lose some marks in the management, okay? Because you will take more than 6 minutes to cover the history, okay? So like it is a balance. If you took long during the history part, which is the most common fatal mistake in the exam, and sometimes it's not avoidable. Why? Because of our ego. We need to ask all the question. We need to show our medical knowledge. No, you just need to take the risk and try to ask the most appropriate and relevant question in the station. To make it easy for you to cut this long story short, try to make the history in 4 minutes, no more than 4 minutes. Okay? If you did the history in 4 minutes, you will have a very good time for the management. And as I usually say, 1 minute in the history, this is just for explanation. 1 minute in the history would equal half a mark. But 1 minute in the management nowadays might give you 3 points. Why? Because all the patient concerned will come in the management. Okay? So the patient will, in the history part, you will keep asking and the patient will keep giving answers. But in the management part, you will explain and the patient will ask you. And you will be marked, you will be scored for this question. Okay? Sometime you will feel that you have done well in this station, but unfortunately not. Why? Because you got only 1 minute, and in this 1 minute for the management, and in this 1 minute, you answered all the patient question he given to you. But actually, he had 8 questions, and you answered only 2. For yourself, it showed that you answered the question, but he still got 6 questions that you didn't give an answer for it. It's a consultation, so you have to deal with it in a whole way. Okay, so my advice from the start: try to cut the history very short. You will lose nothing if you did that, but even you will pass this exam with a high score. For my example, for myself, okay, I didn't use any script. I didn't do any academy, and this was good for myself. So I use my own script. So in the exam, I didn't have this as I said, 25 questions to ask. So it was easy for myself. But the script is very important, by the way. It will save your time, but you need to know how to use the script. Okay, let's skip this point and go to the next point. So I will give common comment on each station, and if anyone have any question, I will be very happy to answer. Let me. I will allow anyone to unmute himself. You can unmute whenever you have any question. Okay. So counseling station. Counseling station is a very wide range of station. I would say 60% of the exam is a counseling station, and this counseling station have subdivision. One of them are breaking bad news, but in general, the counseling station is not a medicine station. Okay, most counseling station in the exam will not be a medical station, even if you felt it is a medical station. Okay, counseling station mean that some event happen, and this is the second time or the third time or the follow-up. The time number 100 for the patient to be seen by you or your colleague. Okay, so it is not the first time for the patient. So you don't need to ask from the scratch. Okay, you could just ask an open question. Okay, like for example, could you give me a quick recap about what happened? Okay, I haven't seen you, I haven't met you before. I went through your notes. And let me just give a comment here. Be natural. We are natural in the NHS. Okay, this is the right way to deal with the patient. This is the right way to pass the exam. Be natural. Like I would say, yeah, actually today, for example, today in the hospital, one of the relative came. I work in the acute unit. So one of the relative came and she asked me, she was a wife and the next of kin for the patient. She asked me, hi, doctor, I came to know that you're the responsible one for my husband. I just want an update. And this is a common question, okay? But actually, I didn't manage to attend the ward round in the morning, so I don't have any information about the patient. So I said to the wife, if you could just give me 10 minutes to go through his notes, and I will come to give you an update. She said, okay, thank you. I will be very grateful for that. Okay, in a very easy way. Okay, so it's okay for yourself to say, I haven't seen you before, but I went through the notes. Could you give me a recap about what happened? Since this is a very nice and life-saving question, it will save you a lot of time in the exam. Okay, and then start. What is the most important question to be asked in any counseling session? Can anyone give me an answer? Open your mic and give me an answer. What is the most important question to be asked in any counseling station? What is the most important question to be asked in any counseling station? Go ahead. I want this to be interactive. From patient, actually, what is the most important question to be asked from a doctor? Sorry, from a doctor to a patient in any counseling station? Idea, concern, expectation. Is it that? Like idea, concern, expectation? The patient understand his condition? Do the patient, yes, please give me an answer. Do the patient understand his condition? What else could be asked? What else could be asked in this situation? So I would say the most important question to be asked in any counseling station is that progression of the presenting illness, especially if it is a discussion of a result of a test that have been done the previous admission or the previous visit. Again, the progression of the presenting illness. The progression of the presenting illness. Someone came with chest pain. Someone came with some bleeding from the back passage. Someone came with fracture and he's in a follow-up. Or someone came with some swelling and he have done some test and he came today to discuss this test. So your question should be, how is this illness? How is this swelling? Okay, why? Because this is the only data gathering that you will need to ask. How is this swelling? Is it the same? Is it increasing? And I would also add one extra question. If it is like some sort of chronic problem, you still have the symptom, I would ask, having this symptom, having this illness for this period of time must have affected your life. What was the impact? Okay, so this is the most important 3 questions to be, and this is the only 3 questions to be asked in any counseling station. The open question about what was the story from the start. The second one, the progression of the presenting illness. And the third one is the impact of this. This is the only question. Unless they mention something in the notes in the station to find out why he had this result of the test. But in the exam, they will not do that. Okay? So this will be the only 3 questions. Through my mocks, I have done a lot of mocks, and through those mocks, most people will keep asking a lot of medicine station till the 6 or 7 minutes in a counseling station, and it wasn't mentioned in the notes in the stem of the scenario to ask this station. Okay, so you will fail the station. Sorry to say that you will not pass the station. Why? Because you will reach the 6 minutes without even discussing the result. Okay, let's go back to breaking bad news. This is one of the most common station in the exam. Definitely you will have one, and also this is one of the common station in your job interviews. Okay, so when you will start to apply for jobs, they might give you a breaking bad news scenario. there is a lot of like structure for this breaking bad news scenarios, and I know through the notes, everyone know how to deal with this situation, but just some tips and tricks in the exam. Okay, breaking bad news means that you will reveal a result of some like serious illness or some like this or some bad news in general. Okay, so and in some at some point you have to break the ice before starting. Okay, you have to break the ice in a nice way. Okay, and in the exam way. Okay, like you will reveal a result of a cancer for a patient. So just break the ice. The question that you will ask to the patient is just to break the ice. Why? Because again, it is not a medicine station. They have given you the result of a cancer. I wonder through the MOOCs, and I usually do like a revision with people after their exam to get like more knowledge about the exam and what they have done, and to compare this what they have done to their result to see what was the impact. And I will usually have this discussion with the PLAB 2 examiner to get this idea about their thinking. Okay, so it is very strange to keep ask a lot of questions, a lot of medical questions about a disease that's already diagnosed. Why you waste your time and you make the examiner nervous? Like you will like look at yourself in the look at you from the camera, and why he's asking all this question? We already given him a diagnosis, and we just asked him to reveal this diagnosis to the patient. Okay, so just ask some question that will break the ice. Okay, sometime the patient will ask you to give him or her the result of the test from the start. My friend, please don't do that. This will make your life miserable in the exam. Okay, but do it in a nice way. She might be concerned. Yeah, I'm very concerned about the result. Can you tell me the result? Yes, yeah, I came actually today to give you the result, but can we have this little chat and to be in a better situation to explain it for you? Yes. Okay. They usually do say yes. Okay. Sometimes they might be very reluctant, but you have to deal with the situation. It is a situation. They might say, no, I'm very adamant to have the results right now. So you have to give the result, and you have to deal with the situation after that. Okay, what is the impact of giving a result in the start? And don't start with this question. From my point of view, this is a very silly question, actually. If you ask it someone, sorry to say that, do you want me to give you the results right now? Don't give the choice to the patient, okay? But make it in like in a nice way. I mean, in the other hand, make it in a form of a nice way. Okay, don't ask. Don't we give the result right now, or can we just have a little chat? So if everyone will say yes, give me the result right now. I came actually today to have the results. Okay, so now you put yourself in troubles. So instead, just actually acknowledge is very important actually in such situation. I've been asked today to discuss the result of your test. So are you okay for me to ask you a couple of questions to be in a better situation to explain the result for you? Yes, I'm okay. Go ahead and break the bad news. I will not say the details of breaking bad news. From my point of view, is easy station to do, but you have to be emotional. You have to be emotional. I know at some points back home we didn't used to be emotional with everyone to bring the bad news in maybe in a different way. Okay, but you have to show the emotion, but not to cry, not to over react, just to be emotional at some point. Okay, to change the tone of your voice. This is very important. Okay, this is for breaking bad news, and don't mention anything that is not in the station. I mean, if it is a cancer, it is a cancer. Okay, if there will be a treatment for it, they will mention this in the station. Okay, if there is no treatment for it, they will mention this in the station. Don't give any false reassurance to the patient, and don't over scare the patient. Okay, also one important thing I don't like actually in the breaking bad news approach for a lot of people, which is to say like, I'm afraid to tell you that I don't have a good news for you today. Okay. I mean, you can just break the bad news in layers instead of over scaring the patient. The news itself is scary. You don't need to double the fairness from the news in the station. Okay. Try to make it easy for yourself in the exam. Does anyone have any question in this point? Can we skip it to the next one? Fine. Everything is okay till now? Do patients understand the patients? Shall we go? Okay, let's go. Teaching station. One of the important station is not common, but is important. Why? Because when you have this station in the exam, I would say it is like it is opportunity to get more marks in this station. Why? Because it will show your medical knowledge first of all. So this one of the station that is important to show your medical knowledge through it, and it will show your teaching skills. And actually, is important because teaching is one of the rules for yourself in the NHS. Okay, so you have to act well in this station, and to act well in this station, you have to train yourself to do it. So I know that most people leave this teaching station and procedure and this stuff till the last day before the exam. Is not advisable to do that actually. Try to do practice on it as soon as possible, as early as possible before your exam. Okay. Use illustration as much as you can, and don't give too much information that is not needed to like for example the F1 or student and or the nurse. And first of all, you have to see if he will be a medical student, if he will be a nurse, if he will be F1. Okay, I have done recently. I have done in my hospital ACS, acute coronary syndrome teaching for the whole F1 in the trust. They are F1. Okay, so you have to explain certain amount of information. Okay, and it is more easy in the exam. Why? Because he will give you the concern. Okay, so they will give you the station, and at the same time they will give you the concern. I mean, this F1 need to know 1, 2, 3. So you have to explain only 1, 2, 3 to give like a short summary about, well, for example, the ECG, and to explain, like he asked about the rate and risk, only the rate and risk. Okay. One common avoidable mistake in teaching that most people, it is a part of teaching actually, to ask the attendees if they understood the information and if they could recap the information. Like I have done, I've asked you a question early on. Okay, this is common, but in the exam is not advisable. Why? Because at most of the time, the role player will not be a medical person. Okay, so he might not be able to give you the answer. And at many stations, they will just mention, don't ask the patient or the role player to recap the information. Okay, this is very important. Yeah, but someone will say this is actually a part of the teaching, how it will be interactive. It could be interactive by assessing if he following you, if he understood this, if he wants you to repeat. It could be interactive by like recapping the information in a very simple way. It could be interactive by cutting this long teaching short in a simple way. Okay, so you don't need to ask this person about to recap this information. It would be very difficult for him or for her. Okay, And at the end, as I said, try to just summarize what you have said in this situation. And in the start also, to give yourself actually some time and to show your knowledge also. You can say this common word, like it might need more than one session. So I will try to explain everything in this session. But if we needed more, I will be more than happy to give it to you. Okay. And actually, the F1, the medical student, the SHO, the registrar, I mean, they're nearly in the same level. Not in the same level. I mean, when you speak to F1, don't show your seniority. Okay, it doesn't work like this here. So just deal with him like your colleague. Okay. This is for teaching station. Actually, I have like a detailed explanation about everything in my website. I will share it with you because we will not have the time to explain everything about everything in this session. It's just tips and tricks and avoidable mistakes. Okay. Let's go to the medical errors. You will have. Does anyone have any question in teaching? If you have any question, just write it down in the chat. Medical errors. Definitely, you will have one medical error in your exam. This is one of the common counseling stations in the exam. Okay. And again, in your job interview, you might have one of this medical error station. So you have to formulate what you will say in this. Tips and tricks. Like any other counseling station, try to get some information about what happened. In most station, the medical error will not be done by yourself. It might be done by one of your colleagues. Okay? So the medical error in most station in PLAB 2 exam will be done by one of your colleagues. So you might not be there at that time the medical error happened. So it is very nice to ask the patient to walk you through what happened. And I would also say, don't start with giving like a clue about what will you say today. Like I'm calling you actually, or I have brought you today because we have done this and done that, and I want to discuss it with you. Okay? Why? Because this is not the exam approach. This could be a real natural life situation approach. Because I got more time, I got 1.5 hours. If the patient got angry at me, I will calm him down, and after that continue my conversation. But in the exam, you don't have this time. Okay, so I would just introduce myself like, hi, this is Dr. Ibrahim. I'm one of the doctors from this hospital, and I'm calling regarding your last visit to. This is a nice word actually. Your last visit actually to the hospital, isn't it? Yeah. How are you today? Just ask him a question. How are you today? And then can you walk me through what happened? And ask the question. If there is any expected adverse action for this medical error, please ask about it. Why? Because you will address this in the management. Again, if there is any adverse action for the medical error that happened, ask about it in the history part. Why? Because you will apply, you will do the management for this in the history part. Okay, the history part in general in any station should be the information that you will use in the management. Okay, if this information is useless in the management, don't ask it. Okay, so and after that reveal the medical error. There is like approach for the medical error itself. Don't everyone knows the approach. We'll just give this advice. Don't like blame yourself for the medical error. Don't blame your colleague. You need to be sorry for that actually. Yes, but actually, doctor, I haven't done this error. Why should be sorry? Because this is the right approach. Okay, because you are talking in the behalf of the hospital, of the trust, in the NHS, on behalf of your colleague. Okay, so you have to be sorry. Okay, and don't be over like don't say a lot of sorry. Just give a logic explanation. It will calm the patient down. I mean, sometimes there will not be a logic explanation. Yes, but how you will tackle the situation, how you will move the situation forward, okay? How you will treat the patient, how you will manage the. Yeah, sometimes medical error happen, and we do datics in the in the hospital many times actually. Uh, Sometimes wrong treatment prescribed for a wrong patient. So we have to explain this and to tell the patient that we have done that and this shouldn't have happened actually, and this is a mistake. Okay, and we will tackle this mistake. And if this patient develop adverse effect, is important to tell him how you will manage this adverse effect. If he is not, you it's important also to reassure him that he doesn't get any adverse effect. Okay, but still there is a mistake. Okay, so you have to tackle this mistake. Is he allowed to file a complaint? Yes, but don't offer him to file a complaint. Actually, I don't like it, and the senior will not like it, and no one will like it actually. To tell the patient, yeah, it is you very open actually to do a complaint against us, against the trust. This is not nice actually. But if the patient said, I'm not happy about it, okay, you can ask him this question: what do you think? What we should do to make you happy, to make you comfortable? Okay, what's your expectation? Such a question is very important. Okay, this is for medical irritation. Let's move to the next one. Problem with your colleague. Everything is okay till this point. Problem with your colleague. Can anyone give me an example for a problem that you might face with one of your colleagues in the hospital? And who consider a colleague in the hospital actually? Coming late? Yeah. Coming late? A common problem? What else? But coming late actually is the most easy question actually. Easy situation you might have with one of your colleagues. I had this situation in one of the breaking confidentiality, yes, in one of the interviews about one of your consultants, a drunk consultant actually. So it could be as easy as one of your colleague, a medical student, is coming late, and it could be as serious as one of your consultants. As I said, one of your consultant is like working under the influence of alcohol or cocaine, or breaking the confidentiality. If, when to call senior in medical station? This is a very good question. This is a very nice question actually, because everyone in the exam would say, I will involve my senior. I will involve my senior. This is a very good question. Do I need to involve my senior in everything? No. If you involve your senior in everything, what you will do? Yes, but as you said, Dr. Ibrahim, in the start, I'm a junior doctor. Yes, you're a junior doctor, but you still allowed for to take a lot of decision. Okay, you will be at the level of F2 or GCF, SHO, sometime according to your level. So you're allowed to take decision. Okay, so you don't need to involve your senior in all situation, but there is some situation that you will need to involve your senior, and don't make it like my senior will come to have the decision. I would say it, yeah. You know, I would take another opinion from my senior, from my registrar. In this way, it would be much more better than. I don't have an answer for this, but I will involve my senior. Okay, so give some thinking in the worst case scenario. Give some thinking about this situation, and then mention this thinking, like this differential diagnosis, and then involve the senior. Do you need to really involve your senior in each session? No, you don't need to do that. Okay, you will involve your senior only in serious situation like some manifestation, for example, or some situation that you can't find an answer, or sometimes the patient will ask you himself to speak to your senior. It's okay if your senior is available to do that. Okay. Coming back to the problem with your colleague, there is a wide range of station, and again, this is one of the important station for the exam and for your job interviews. Is important for the service job, is important for a training job. It is important for higher specialty. Is important for everything actually. So you have to know how to tackle this situation very well in the exam. Okay. So there is like actually a technique to do this, but I will not take about the approach. We'll take about some advices. First of all, you have to take some history to speak to the person, to your colleague. Why? Because sometimes you will be informed about the problem. You didn't see the problem yourself, or you didn't see the event yourself. The nurse told you, one of the other colleagues told you. Okay, so in such a situation, you have to take some history and after that confront your colleague. Okay, in a nice way. Some problem with colleague should be tackled as a teaching station. Like for example, this if one that put a post on the Facebook. Okay, if he knows about the rules, he wouldn't do that. If you know about that the patient lack the capacity to give consent to put this such thing, he wouldn't do that. So your rule here is to protect the patient's safety, okay, and teach your colleague. Why? Because this will be reflected in his good practice in the future. Okay, so he will not do the same mistake again. Okay, but it is not the right approach to just confront him from the start, to show him that he's in trouble, to show him that he have done a fatal mistake and all this stuff. You have to confront, yes. You have to explain that there is a problem already, okay? And this problem might have affected one of some patient, okay? And this is actually not acceptable, but in a nice way, okay? I mean, there is two ways. I will give you a realistic example. In one of my mocks, there is a medical this Facebook station, okay? I've given you one of the station. And one of the doctor have done this station with me before, and he started to say, oh, Alex, you have put this post in the Facebook. Shame on you. You know that this will make you lose your license to work as a doctor. You shouldn't have done that. I will report this to your senior. This is a completely fatal mistake. Okay, a completely fatal mistake. You will fail this station. Okay, and another one start to gather some information, and after that to ask about the consequence. Like for example, do you know the consequence of uploading such post? Do you know the consequence of working under the influence of alcohol? Do you know the consequence of coming late? Sometime at some point, your colleague might not understand the impact of his problem. Okay. In problem colleague stations, you have two patients. The main patient, the patient we have already. Okay. You have to make sure that they are safe. And the other patient is your colleague. You have to treat your colleague. Okay. He's coming late because of a problem. And a lot of people in this coming late station, because it's common station actually, you have to acknowledge first. Sometimes your colleague already made a plan with the senior to come this late. Okay, made a change in his contract. This happened actually because he lived like 2 hours from the hospital. He made a change in his contract to come from 9. Okay, so it is your problem that you don't know. That's why I'm asking you to ask your colleague first to acknowledge what is the problem, why he's coming late. Okay, and you should prepare yourself for a denial in any problem with your colleague. he will deny in the start, and after that he will start to give you the information. Okay. Should I just ignore it if it is a first time for him? Like, according to what is the problem? Like, if he's coming late, yeah, you can just give an advice about it. But if like one of your colleagues under influence of alcohol, no, you can't skip it. You have to escalate this to the highest level after you spoke to your colleague and you discuss it with him. Why? Because he lacks the insight that enable him to understand that he can't work under the influence of alcohol. And this will harm. He could just say, I'm sick, I'm not well enough to come today. And no one will ask him to come. This is easy, actually, by the way, in the NHS. I'm not feeling well, actually, to come today. And this is safe for the patient, okay? If he very agitated or if he, like you suspect he's under influence of alcohol, he shouldn't have come today and he should take this day off, okay? This is about problem with your colleague. Write down your question if you have any. Okay, phone calls. Actually, this is a general approach. Phone calls nowadays can come as any station, but it will be most commonly it will be counseling station or medicine station. Okay, I mean procedure and semen can't be done as a phone call, so it is only medicine and counseling station. Okay, so after confirmation, and I've heard a lot from a lot of people actually that they don't like phone calls. In my exam, I had this 6 phone call station. Okay, and it was the best thing happened in my exam. Why? Because I have the notes. I don't have a patient in the cube, and I have a phone. Okay, so I'm not like under any pressure. Okay, and it was easy, but you have to again to train yourself to do this. Try to do a phone call, a realistic phone call. Actually, the phone will be on a speaker mode, so you don't need to hold the phone itself. You have to introduce yourself first. Like, don't start with confirming the patient identity or address or date of birth. Just start with introducing yourself. Like, hi, this is Dr. Ibrahim. I'm one of the doctor calling from this hospital. Is it a good time to talk? Shall I call later on? Yes, it is a good time to talk. Okay. It will be always a good time to talk. Okay, why? Because it is the exam. If it is not a good time to talk, they will not bring the station actually. But you have to ask this question. Why? Because this is a realistic simulation for the real life. As I said, it is like acting in Arabic, tamsil. Okay? And then confirm the identity of the patient. Mainly, you have to confirm the name, the date of birth, and the address. Not the age, actually. The date of birth and the address. Okay. Sometime you will need to confirm the relationship to the patient if you not talking about the one on the phone himself, about one of the relative. So you have to confirm the relation to the patient himself. Okay, and start to reveal this result. Start to address this patient concern. At some point, the line might like there might be a trouble in connection. Ask him to repeat again. It's fine to ask the patient to repeat again. In the day of my exam, one of my colleagues had some trouble with one of the phone calls. So he went out of the cube during the exam time itself. And he said, I can't hear anything through the phone. There is a trouble. And they let him do the station again after everyone finished the exam. This happened in front of myself. So I'm sure about it. If you face like a fatal troubles in the phone call, just let the admin in this place know about it. Okay, because a lot of people fail this station because trouble in connection, for example, and sometimes they will do the trouble in connection by themselves to see how much you will be safe. Actually, I mean, Sometimes you'll just, okay, yes, yes, yeah, okay. So, but you didn't hear anything, okay? And they know that you didn't hear anything. And you said that you understood what is going on. This is not safe. It is the same like if someone is speaking in a different accent or a difficult accent, and you said, yeah, okay, yeah, I'm understand. No, ask him to repeat again. I didn't get this point. Okay, forgive me. Sometime he might be from somewhere, anywhere. Actually, you can face difficulty with any patient from UK anywhere, not only a specific place actually. So you could ask him to repeat again to make it more clear, to make it more simple for you. This is better than to just ignore it. Why? Because he might have said some important information that you missed. Just make sure that you will not do this mistake. And try to end the station in a nice way. Don't just close the line. Just try to say bye, for example. Try to give like some advice if this station needs some advice. Try to give like some safety netting if this station needs some safety netting. It's not like nice actually to just close the line at the end of the station after finishing all your question. Okay, you can do this station actually in less than 6 minutes from the start till the end. I've done most of them in the exam, in my exam, in less than 6 minutes actually. Okay, this is about phone call. Angry patient, angry relative. Everyone is okay? Everything is okay till now? Does anyone have any question? Can I ask them to bring me some water? Okay. Angry patient, angry relative. It's not a common station, but it is difficult station in the exam. It's difficult, very difficult station. So you have to prepare yourself and you have to relax. And this patient will try to push you to be nervous. Okay. And sometimes he might be angry about the healthcare service he have in the hospital, because he's, for example, he's waiting for a long time, which is normal in the NHS. Maybe because some mistake happened. Maybe because, as I said, medical error by one of your colleagues. Okay. Maybe an unexpected adverse effect happen in some situation. Maybe he's angry because he's angry. He's a nervous person. Okay. So you have to tackle the situation. You have to control the situation, but you have to be nice. Okay. Be logic in this situation, but give an apology for his feeling, actually, for not for what happened. Okay. If he have a logic reason to be angry, you have to explain what's happened and to give a logic explanation for it. But if he doesn't have a logic reason to be angry, you have to explain, to be sorry for what is, like, I'm sorry for what you have been through or for your feeling, but we have done this and we have done that, and this is what happened. Okay, so it's not nice actually to confront patient from the start or to be harsh with the patient from the start. It will make the situation more difficult. Okay. One important thing to bear in your mind in this situation, that he is a role player, he's an actor, he's not a real angry patient. Why? Because yesterday, the last week I'm doing a mock, and one of the doctors said, I had this station in my exam about this angry patient, and I didn't manage to do well in this station. And unfortunately, the next 3 station, it was very bad. I didn't manage to pass the next 3 station. So it is not only about this station, it's about the second and third and fourth station after that. Okay, so try Try to your best to control your nervous in this situation, to be nice to the patient till the end. Okay, try to understand why he's angry. Try to give a logic explanation about it, and try to give him a plan how you will correct the situation. One of the common mistake in such situations. One of the common mistake in this situation, your colleague have done a mistake, and the patient is angry now, and you have been asked to talk to this patient. So to make your situation more much better, you will start to say, yeah, he shouldn't have done that. Actually, this is not the right thing to be done in this situation. This is a fatal mistake, my friend. This is a fatal mistake. Don't put your colleague in trouble. It is one team. It is one hospital. It is one trust. Okay? You will be all in trouble. Okay? But again, don't like defend him like without any like rights. I mean, be fair. But there is also some, I mean, there is some mean ways to do it. I would say like I haven't been actually in this when this happened, but I have to have a word with my colleague to get some more information about it, especially if they didn't mention enough information in the station, and they usually do. So I have to speak to your colleague and have a word with him about what happened, and I will let you know about the outcomes. Okay. So I didn't say anything. I didn't say he is right. I didn't say he's wrong. But this is the diplomatic answer for the exam, and 80% of the answer in the exam should be diplomatic, actually. Okay, it shouldn't be a straightforward answer. And actually, the patient himself, he will not be a straightforward patient. And the English language itself is not a straightforward. If you are asking someone, ask one of your colleague, one of your English colleague about something, and he doesn't know, he would say, "I'm not sure actually about it." He didn't say, "I don't know it." He didn't say, "I know it." He didn't say that. He just, I'm not sure about it actually. Okay, if you ask him, "How are you?" Not too bad. You could say just, "I'm good, I'm okay." No, not too bad. So sometimes the answer will not be a straightforward answer, okay? And try to deal with the situation this way. Even in a lot of medicine station, it doesn't need to be a straightforward answer. How come you will give a diagnosis of subarachnoid hemorrhage in 8 minutes? Come on, my friend, we take like a 1.5 days to do that. Sometimes we need to do a lumbar puncture and wait for the result to come and do a CT scan and all this stuff. And this would take at least like 20 minutes plus the waiting time for the patient to give an answer. So don't be genius and give the answer in or after like 8 minutes. Give it in a way of suspicion. It is not a straightforward answer. Okay, this is important for the exam actually, because a lot of people think that if I'm not sure 100%, so I will not get the full mark. No, you will get the full mark. Okay, just take the risk. Sometimes the angry role player will be a relative. Okay, so and the situation will be more difficult because you have to explain everything, and you have to know first if we have the right to know the information or not. It might be the next of kin, or there might be like a consent to speak to him. Okay, and this consent will be mentioned unless there will be no station. This consent will be mentioned in the stem itself. Okay, so you have to explain what's happened, and you have to address his concern at the end of the station. This one of the station, actually, if you did well in it, you will have the feeling of like that you have done well. I got this thumb up in this station in my exam. Okay, I got this angry patient, and at the end he did that. I got this thumb up like 3 or 4 times, as I remember, in my exam. Okay, and this happened with not only with me, with many people actually in the exam. If you have done the station in a nice way, they might show you that you have done well in this station. Okay, this is reassuring for yourself. You will feel that you relieved in such a station. Okay, One of the angry patients will be angry because he wanted a CT scan for his child, okay, who came with a scratch, and he's suspecting something. Like, I will give you a realistic example. The last week, I went to take a consent from a 20-year-old girl for an OGD, for endoscopy actually, and her grandma, she used to be a nurse, and she started to say, no, I'm not, we will not do that. Why you will do an OGD? You do MRI scan for my daughter. And she started to say, it will show what's happening there, and you need to save this money. A typical situation, actually. You need to save some money for the NHS. This is her right to do that. Actually, I was harsh, but I don't advise you to be harsh in the exam. So I have there, sorry, what did you used to do when you used to work? She said, I'm a nurse. So I said, acha, okay, yeah, that's why. Okay, so you have some medical information, right? Yes, she did right. Okay, do you have guidelines for diagnosing some GI bleed? She said no. Okay, that's it. In 20 seconds, but I did it in a very nice way, by the way. I wasn't too harsh to like to make her feel bad about herself, or to just make her feel bad in front of her was it a granddaughter? Yeah. So it is just a nice confrontation. And at some point, you might need to do that. You don't need to do any unnecessary investigation depending on the patient or relative question. Okay, that's it for angry patient. Okay, Simman station. I think this is Simman and procedure, and we'll end the session today. Simman station, common from my point of view, easy. I would say it is like a reward in the exam, but unfortunately, a lot of people fail this. Okay, why do you fail this? Because they deal with the situation as a medicine station. This is a medicine, yes, but it is emergency. So you have to show the emergency attitude. Why? Because sometimes the patient will be severely ill. Okay, so what you should do? You have to act very quick. Okay. Yeah, during your internship or during your job back home, you have done at least some shifts in the emergency, and you know how they deal with someone who came with like cardiac arrest, or who came with some severe form of some illness, and he need emergency resuscitation. Okay, so in your tone of voice itself should be quick. Okay, I'm here to help you. So what's happening? Okay, so I will put you through this. I will do that in a confident emergency way. Okay, but actually I've seen this through the mocks. Okay, so what's your name? I'm dying, help me. Okay, just can you confirm your name? Please help me, I can't take my... And he is waiting like for 2 or 3 minutes to confirm the name of the patient. He could just confirm the name of the patient from his hand. Okay, so show the emergency attitude. Okay, and in most of the Simman station will be in the same severity of illness in the exam, which means they are in a mildly severe illness, not severe, a mildly illness in the exam, that will allow you to take a very short history, no more than 1 minute history in the start, to understand the situation. Okay, but in unfortunately some situation, they might be unresponsive. This is a different situation. Okay, but 90% of the Simman will be responsive, and he might give you the chance to ask him 3 or 4 questions. Take this chance and ask it in a very quick way. Okay, don't be scripted in the Simman. Don't be scripted. Yeah, ABCD approach is important, and you have to apply the ABCD approach from the start till the end, but don't be scripted. It is not the same. Simman is not the same all the time. Why? Because as I said, it is different severity. Okay, and what your colleague have done in his exam is different from what you will do in your exam. I mean, he might have given all the treatment for acute exacerbation of asthma, but you might need only to give salbutamol, for example, nebulizer for this patient, and he will be okay. So as I said, it is not the same severity, okay? And deal with the Simman itself as a patient. Simman is a talking mannequin. He will give you responses for everything. And if he couldn't give a response, if he couldn't give an answer, from the background, your examiner will give the answer. Like, okay, I will use my stethoscope to check, to listen to your lung sound. Okay, put the stethoscope. You might not be able to hear something, but the examiner will say, okay, there is like a harsh racing sound, or there is expiratory wheeze or bimesal cryptis. He might say something in the background. So, because the examiner will help you, actually, from my point of view, you have to verbalize everything, but not in the way of teaching, in the way of doing a real life situation. Okay, you have the team around you. Okay, so now I will check your chest. Okay, now I will feel your, so verbalize everything in the way you explaining and taking a consent from the patient. Okay, and at the same time, the examiner in the background, he will give the answers for this question in an indirect way. Okay, like you might ask, okay, have you taken any medication? So in the background, the examiner would say, no, he haven't taken any medication. Okay, you have to apply all the ABCD approach. Why? Actually, I've seen also, this is from a real situation, I've seen a lot of doctor at the moment they reach the diagnosis, stop to assess the patient. Like, this is asthma exacerbation. The problem is in the, like, for example, I've discovered the problem in the B part. So he just give the medication and he stopped to do the C. It could be anaphylactic shock. It could be something else. He might come with multiple severe problem. So you have to do the whole EBCDE approach, and actually you will be assessed for the whole EBCD approach. Okay. Do we have any markers for the IBS on the Simman? Do we have any markers for the IBS in the Simman? Can anyone give me an answer? IBS markers in the Simman? I would say yes. It's not a real IBS markers actually, but it is important to be nice, to be safe, to show that you care for the patient. Okay. So, like, for example, whenever you give some medication, you have to ask the patient if this medication have done its effect or not. Okay. So, do you feel better? This is IBS, by the way. It checks the monitor for the improvement. This is IBS, by the way. If it didn't show any improvement, he still feels the same, give some reflection. Okay, I will move to the next step. I have to just examine your, for example, your chest, and I will give you appropriate medication for that. This is IBS, by the way. Okay. I would also advise you to start managing the patient from the first or maximum second point. Why? Because if you waited longer than that, the patient might arrest and he might die. Recently, in one of the exams, I think in the last few weeks, the GI believed Simman passed away during the exam. Okay. And the doctor failed the station. Okay. See, bear in your mind that this might happen in your situation. I would be confident, actually. I haven't been in this situation. I have been in this situation in real life, in the cardiac arrest, many times when I used to do a world cover. But I haven't been through it in the exam. But I would be confident. Okay. I would assess the patient if the patient is responsive really, or he passed away. And I would mention that the patient passed away. Okay, this is a real life situation. Okay, I would assess the pulse of the patient. I would do it like a confirmation of this for this patient. I know that it is like some sort of black comedy, but this will save you from failing this station. Okay, like I would, yeah, assess the pulse of the patient. I would like uh, move his shoulder to see if he's responding to pain, to verbal stimuli. The GCS for the patient. If he still have any breathing sound, if he still got any pulse, okay. Like I would say, after like 3 minutes of assessment, I can find the breathing sound, a pulse. Patient is not responsive to pain, pupil are fixed, and bilaterally equal, not responsive to light. Okay, so I think my patient passed away in a very easy way. I know. I know it's easy for me to say it, but in the exam it's difficult. But this is the only way for yourself to pass. 1 mark, even half a point in this exam would make a difference. Okay, so take my words very seriously. Okay, this is for station. There is a very nice course actually on my website. It's a 3-hour course that cover all the station. Actually, you can sign up for it. The procedure station. I will give example in myself. I swear God, I haven't done any academy. Okay, and I swear God, it's the first time for me to do the procedure. It was in my exam. I haven't done this procedure at least once before my exam in UK. Yeah, I have done it in my home country, but it was a different equipment than we have in the GMC, and I managed to pass this station even with good score. Okay. So you just need to know how you will do the station. Okay, you have to be familiar with the equipment. Okay, it shouldn't be. If you got the chance to see it in real life, it's okay. If you didn't get the chance, it's not a big problem actually. Just be familiar with it. Okay, over the internet there is a lot of resources. Again, I have also a course for this procedure in my website. Okay, and Geek Medics is nice also for anyone. So just make yourself familiar with it and try to practice this procedure station before your exam. Don't make it the first time. It is easy station. Okay, and sometimes it will be a procedure and talking to the patient at the same time, and this is difficult. And one of the worst things that they usually do, sometimes they will hide the man that you will do the procedure on it. So you have to search, to give a wide look in the cube to find this man. Okay, this mannequin that you will do the procedure in it. It is very important actually. Okay, and while you doing the procedure itself, look to the patient, see his response. Okay, I mean, yeah, you will do it. It is weird, actually. It is weird. And it was weird for me in the exam, but we have to do it in this way. Like, put a cannula for this mannequin and look at the face reaction for the role player. And actually, he will give a face responses for what's happening. Okay. And in most situations, there will be a question that should be answered. Okay. This man might have, or this woman might have, I got this baby spear in my exam, and they said in the notes that the patient have some question and you should answer this question. And because I used to ask open question in the start finish station, and I usually ask more than one open question in the start. So she asked me this question before doing the procedure. It was a mistake from her side. It should be done after the procedure. Even the examiner looked at her like this. It should be at the end, but I mean, she made it by mistake. But this is because I used to do open question. Okay, so I advise you also to do open question in the station. Okay, try to familiar yourself with the procedure itself. It's different from we do it back home. Actually, at some point we don't do all the procedure back home. The system is different. The nurses will do the procedure and you will do other stuff. But the system here is different. Actually, you have to do the procedure yourself. It's not the nurse responsibility. It's your responsibility or the phlebotomist or the clinical assistant responsibility. So you have to deal with it. Okay, and if things got messy in the the procedure, control your nerves, and try to correct it again. It's fine. I mean, in real life, you might try to put a cannula 3 times for a patient. It's fine. Okay, it's fine. Just try to be nice. Like yesterday, I have been asked by one of my colleagues to no, not yesterday, the last week, to take a blood sample from one of the patients. Okay, because he tried many times actually, and I will explain a more difficult situation actually. 1 month ago, I was on call on ward cover, and I've been asked by one of the registrars to bleed one of the patients actually in one of the wards because one of the SHO tried and she failed, and the phlebotomy tried and she failed. Okay, they try about 8 times to bleed the patient. Okay, and this example is not to show off actually, but I need you to catch something in this situation. So I went to this woman and I said, "Hi, I'm Dr. Ibrahim. I'm one of the medical doctors here. And I've heard that you made it very difficult actually for my colleagues. You made their life difficult. They tried many times to get your veins, but you hide it, right?" In a very sarcastic comedy way. And she said, "Oh yeah, I've tried to help them, but unfortunately, I didn't. I think I have a weak veins." And she was very anxious with my colleague before. Okay, so I said, "Okay, so if I brought my stuff and if I give it a trial, will you help me, or will you make it difficult for myself?" She said, "I will help you." And she holds the torch for myself to get the blood from her. Okay, so this is the first part of the story. So I've been asked to take 2 blood culture bottles from her. I managed to get this blood culture from her, but for some reason, the SHO didn't tell me that I need to take 2 sets of the blood culture because this is a query from the micro. So I have to return back and to find a vein. This is not the problem. It's to tell the patient that we'll need to take another blood sample actually. Okay, I managed to do that at the end also by like a funny way. So I mean, I've told her I have a very bad news for you actually. What happened? Have you lost these 2 samples? No, I didn't lose them, but the microbiology asked for another 2 samples. And they didn't mention this before I came to you. They just mentioned this right now. And unfortunately, we have to go through this again. I said, we have to go through this together again. Okay, yeah, I will try from the same vein, but if I said that, if I didn't manage, I might use another vein. Okay, we have to do it. I know it is difficult for you, but you have a known infection and your infection marker is very high, and we have to deal with that. Okay, if it is not me, it will be someone else who will come after me to do this. To cut this long story short, you don't need it for your exam. But I mean, if you failed to do any procedure in the exam, just be confident. Okay, sorry, I have to do it again. Okay, I will try another vein. If I didn't manage, I will ask one of my colleagues to do that. Okay, that's it for the procedure part. And that's it for today's session. I hope that you got the ultimate benefit from today's session, and it will help you in your preparation. And again, sorry for those who couldn't attend because of the time. I will try to get another another session suitable for everyone and announce for it early on with enough time. And again, we have this PLAB 2 course. I have this good actually course is a very nice realistic crash course. I would say crash course actually. It covers about 150 to 200 station of the exam. But this is, I would say, like the secret to pass this station. It is not that comprehensive, detailed course about everything. It It is the approach and how you will apply the approach. And it's actually my advice. My advice to everyone is to know the approach for everything and try to apply this approach. Okay. And also this course contains the procedure, as I said, and the SIMAN course, the medical orientation, the most common for the exam, the learning disabilities, learning difficulty situations, all the difficult situations that you might ever put in your brain is in this course actually. Is nice for those who start or those who had the exam after 1 month. It didn't make a difference. If you got a time and you still got like 2 or 3 weeks, you still manage to do this course. It is only 20-hour course, and I think they will do a good discount in the start of this new year. And Alhamdulillah, we have this about 10 cycle for this course, and the outcomes was very good. I will share the outcomes in my groups, and you can see it. I do MOOCs also, but I'm limited actually for dates. I've been booked for the next like 2.5 months, but sometimes I give priority for those who have the exam. Again, I'm very open to answer any of your question. If any one of you have any question in his mind, you can put it there, or later on you can put it in one of my group. If you got any scenario, I'm very confident about that, because alhamdulillah, thanks to God, I've done a lot in this journey. If you got any question in your mind and you think it is difficult, I will have a good answer for it. Okay, so just share this question in one of my group or send this to me in private, and I will answer it. Let me just share my 1 second. Let me just do that. Okay, the link for okay.